are all related to the COVID-19. So for example, we have crackdowns by the government in all the different areas in Africa. So we have, for example, Uganda having a complete lockdown, not allowing anybody to come in or out of Uganda, not allowing anybody to come in or out of their houses. And this is affecting the economy of our Jamaat members. We also have a similar situation in Kenya. In Kenya, we have a curfew. It's not a complete lockdown, but it's something that's affecting business a lot. We have small business owners who are complaining that there is no business anymore. And I'm sure this is something which is a global issue. It's not only affecting Africa only, but because of the situation in Africa, whereby the government doesn't actually support as much as you find the support in Europe and in the US. So when we look at the same issues affecting us over here in Africa, we tend to find that the impact is much greater and the needs are increasing rapidly. We find also food shortages, we find other issues which are affecting us over here. In Tanzania itself, we have only about 60 cases, but with those 60 cases in place, the crackdown in terms of the economy, in terms of the situation, is very dire. In Madagascar, also in our Jamaats of Siroy and in Reunion Islands, which is the Yuaxer, basically they have been affected also by this economic situation. And we find that our various regional bodies are trying to cope with this situation. We're trying to take as many precautions as we can. We're trying to support the families. We already have food distributions. We have already so many other things in place which we're trying to handle, and we're trying to sort out this crisis. I think that's just an overview of what's happening in Africa.
Thank you, Zuhair. I'll come to you shortly as well for some more prodding questions. We're going to split the medical side from the economic side as I ask the various questions, but thank you for that. I'm going to go straight to Shahid Bhai Badami from Pakistan Federation. If you could give us just an overview of how the crisis has affected, both in terms of number of cases, as Dr. Akbar highlighted, the data that he has, if you have any data as well of how many community members are directly affected by it, but also if you can give us just a quick background on the economic side as well.
Bismillah ar-Rahman ar-Rahim. Thank you, Shah. Assalamu alaikum wa rahmatullahi wa barakatuh, all of you. First of all, thank you very much for hosting this program, as this program will help all the members to know the situation of each region because of the coronavirus and what challenges each region have because of this virus and how they are addressing those challenges. And at the same time, each one of us would be able to know how can we help each other to fight against this epidemic. As far as Pakistan is concerned, till now we have around 7,000 cases reported as corona positive, and around 150 deaths reported because of the virus, which is alhamdulillah comparatively very low if we compare it with the rest of the world. If we specifically talk about Khojas, the very second case which was reported in Pakistan was one of our Khoja brother who returned from the Iran. And alhamdulillah, he's fine now and he's back, alhamdulillah. Yesterday, we got a news that one of our Khoja brother, who is a doctor and was fighting against the epidemic on a frontline soldier, got his corona test positive. And now he is in quarantine, and may Allah give him good health, inshallah. So till now, the reported cases of corona positive in Khojas of Pakistan is only 2. And no death of any Khoja is reported till now, alhamdulillah, because of this epidemic. So this is what the basic statistics of our region. Thank you.
Thank you, Shahid Bhai. I'll come to you shortly back on the economic side, but if I come to Arif Bhai Jaxi, both if you can give us just an overview of how it's directly affected the Simcoe region, both Canada and North USA as well as an economic, just a quick economic outline as well, particularly on the US side.
Assalamu alaikum, everyone, and thank you for hosting this webinar. So from the, and hello from New York, the epicenter of the world. That's where we are currently. We're trying our best to stay away and obviously staying at home and trying, social distancing as much as we can. As far as North America is concerned, we've been impacted quite a bit, as you can see in the world numbers. New York has been quite affected in terms of its population and the amount of people that are participating in work. There's essential workers still going out, to do their part. There's still needs that have to be met, so people are going out for example, grocery runs or medical runs, etc. So just that, being that the population is so high here in New York, there's always going to be some kind of interaction that's going to take place. As far as the numbers are concerned, it's obviously staggering that you see on the news. We have had cases whereby it's not within our own member Jamaats. However, there are our brothers that we come across through funeral home information that they are being overwhelmed with the amount of deaths that are taking place. I'm not sure if you've seen any videos recently, but they are being overwhelmed with the amount of bodies that are coming in, with the amount of burial that needs to take place. There are funeral homes that actually have fridge burial trucks outside, so as to fill that capacity of the bodies that are coming in. There are lack of volunteers or people that are actually going to do the burial rites and ghusl, etc. So because of that, there was a recent death in our community, which seems to be non-COVID related. The news that came back was that there was a 2-week delay in the burials because of this. And so there are, the amounts are staggering. They're still continuing to be, as long as we take our precautions in flattening the curve with whatever advice that has been given by the governments and from the local authorities. We should try our best to stay away. And but however, being that the metropolitan area that we're in, we are going to continue to see these numbers. As far as Nasimco Jamaats are concerned, we haven't gotten any specific reports on any deaths, alhamdulillah, within our member Jamaats. There was the COVID cases that we see amongst other Jamaats that are Shia based within our area that have been affected by COVID. I don't have specific numbers, but there are cases that are currently taking place, and deaths as well that have taken place. Economically, we have some government support from both Canada and the US. So that we are grateful for, that the government has stepped in, provide businesses with stimulus packages, and also individuals so as to give them direct access to funding. So that is already starting to work. Stimulus package for businesses has just recently run out, but we're hoping that the Congress will supply more additional funding towards this cause. So as far as funding is concerned, alhamdulillah, at least we have some kind of backing. However, you will always find those that will fall through the cracks, and those are the ones that we need to support. And obviously we will need to make this more of a global support as opposed to just a North American one. So.
Thank you, Arif, for that. I think you're quite right. I think although these governments have put forward, bailouts, have put forward kind of schemes, put forward big amounts of funds. This is borrowing, our money, our kids' money, and so on and so forth. This is just adding leverage on, and in fact, there'll be huge economic ramifications in North America, in Europe, in Australia, and so on. On the subject of Australia, Abbas, if I can bring yourself in, I think when you look at the global statistics, it looked like Europe is and probably has been the epicenter. Of course, North America, Arif Bhai says quite rightly, New York looks like the absolute epicenter. It doesn't look like to have hit Australia as much. Is that perception correct, or where do you see that?
Look, Australia has been, alhamdulillah, very, very lucky. Assalamu alaikum first to everyone. So I was just looking at the numbers from what the update was from this morning, and it's showing that Australia has had 6,522 cases with a total of 65 deaths. And most of that was related to a ship that had docked here. But from a community perspective, it has been very, very low. We've had a few members who had been infected with COVID-19, but alhamdulillah, we haven't had as yet from our community any fatalities here. And the government is doing a lot here as in the US and in the UK in where we're going. But alhamdulillah, the community in terms of health is holding up pretty well.
Thank you, Abbas. No, I appreciate that. Thank you so much. And Mohsen Uncle, for India, last but by no means least, of course, our home. For India, if you could tell us again the situation, the medical situation, if you could brief us on the economic situation, which I know is great, it's huge in India as well, and then also your assistance that you're giving to frontline medics, which I believe some of the India Federation and community there is stepping up in.
Yes, India, the number of cases overall in the country is rising. It is still rising exponentially. In our community, unfortunately, one person has passed away in Mumbai, and 5 of his family members are in isolation under quarantine. The community has been very good. Even before the government brought in rules and regulations about distancing and closing of centers, most of our centers were closed. Most of our programs got closed, and alhamdulillah, online programs started. And these all online programs are very useful for the public. The community, as it is, had a very large number of poor people, and as soon as the problem arose, the local people immediately came to help. People raised funds, Jamaats raised funds, public people, philanthropists themselves started helping people, and in the first month that was possible, and the community coped. The second month now, the number of people who need assistance has risen tremendously because a lot of people have lost their jobs. People with shops, people with rickshaw drivers, and some day wage earners. All these people have lost their jobs, and they are now facing difficulties. And we realize that the problem in the world is everywhere. So raising funds from anywhere is going to be quite difficult. But we hope that we will be receiving help soon, so that at least for the month of Ramadan, we can help people to be a little bit at peace, so that they can spend more of their time in prayers and worship. Most of the Jamaats are already organizing online Quran Khanis, children's programs online, and Amals online. These are all being planned and being put into practice. The economic condition is going to deteriorate quite badly, but we will know the real figure in a couple of months' time, probably about June. Because in the meantime, the immediate effect is the lack of food and provisions in people's houses, and that is causing quite a lot of problems. Another problem that we will have to again organize is to have lots of volunteers, because many old people and widows, we will have to have volunteers to go to their houses. As Shan, you mentioned about the frontline doctors, we immediately started a database of our doctors and medical personnel. This is now discussing regularly on what to do about the community. They have also produced guidelines And also, for example, you talked at the task force level, we have been discussing the mental state and problems that has already been tackled here. A couple of our psychiatrists have produced videos for the guideline of the public. Generally, the community has raised and came forward quite well. And Alhamdulillah, so far the Federation is hoping, with the help of the Jamaat and the Council of Gujarat and the Kutch Federation, and let us hope that the condition does not deteriorate so badly that we may not be able to cope. If there's any question, then I can answer specifically.
Thanks, Mohsen Uncle. I think I'll come more now on the economic side. So we've discussed the medical side, some of the statistics now, and I want to go on to the economic side and start to really prod a little bit deeper. Later on, if we get time, we will discuss mental health, which is very, very important as well, because people's mental health are being highly affected by being quarantined, by being in lockdown, some of them being isolated from their families and so on. But we'll come to that later on, and we'll also try and discuss the spiritual element as well, if we can. On the economic one, I want to bring in Shahid Bhai Badami now in Pakistan. We are giving out, and Karachi Jamaat is giving out distribution to families in Pakistan. Could you give us, please, just an information on how much distribution, how much ration packs are giving, and according to you, how many members in Karachi of our community are deserving or have that kind of day-to-day need where we need to support them?
Thank you, Shah. I think we have provided you all the data, okay, what we actually need in terms of ration and all these things. Till now, Karachi Jamaat and all the organizations here in Pakistan distributed somewhere around 1,600 ration packs, and in interior Sindh, we have distributed somewhere around 300 ration in interior Sindh. And in fact, when lockdown started, the immediate need was to ensure the supply of necessity food items and medicines to those members who suffered because of this and doesn't have enough resources to meet these basic requirements for the families. Pakistan Federation, as well as other organizations of the country, addressed this issue very generously. And I would really like to thank all the organizations, volunteers, and philanthropists who came forward and ensured that the necessary ration and medicines reached to the doorstep of every needy individual.
Thank you, Shahid Bhai. Thank you, really appreciate it. I think from all the statistics we've had so far, we've had an economic substream we have of the task force. So just to brief everybody, we have a task force on this, which all our members here are, part of that task force representing their various regions. And within the task force, we have an economic stream. And we had, as we know, every week we have a 2-hour-long call, very long call, hard to pay attention for a whole 2 hours. But in the last one, we had an economic stream discussion. And in that, we said immediately, according to the data we have 5,000 families of our community who need support for day-to-day rations. If this goes on for another 2 months, we think we will have almost 10,000 families that will need support. And then it goes on and on and on. And so the immediate need we identified was about $2 million, of which 1.4 million we want to raise very, very urgently. I know for Pirai Jamaat, for example, the need is $100,000 a month just on ration support from us. I don't know what your full spending is. I'm sure the spending of Pirai is even bigger, but World Federation, or as a collective, we are stepping in with $100,000 a month, or whatever it might be, and so on and so forth. So the point I wanted to hit was in Karachi, we have, and in India and in Africa, we have people who need day-to-day funding and support. And I want to bring in Zuhair by now, if you can give us the economic situation in Africa, both for those who are deserving, but also for the middle class as well, and also take it forward. Not only how does it affect them now, but if the lockdown goes on for another month or so, what do you think the effect will be on the community?
Okay, so let me just start off with a case that came to my attention a few days ago, whereby there's somebody who was from our Jamaat, our member. He's an Uber driver, and he's been earning his income his daily bread from just driving people around as a taxi driver. And now that the COVID-19 breakout has really affected the countries in terms of in Africa, the countries in Africa in terms of the economic shutdown, he's had to sit at home, and this is directly affecting him. So now we have many other members who have a similar situation, whereby they have a small business that they're running, or a small amount of income that they're gaining in a day-to-day basis, very minimal savings. And these people have been able to stay afloat with their economic needs due to this little bit of income that they've been receiving. Now that this outbreak has happened, we find that these are the middle class or the lower end who would now actually require at least some kind of food support ration on their tables, and including maybe something like a little bit of rent support, and something to enhance their businesses as well. If it's somebody who has an ability to turn the business into an online kind of business. So we have this cases rising day to day. We have issues like in Tanzania, we have prices of food which are increasing rapidly in a day-to-day basis. So that's also affecting the community drastically. We have various initiatives that we are trying to start and we're trying to fulfill. But just to get back to your question, if we have this COVID continuing on like this, and this crackdown the way it is right now going on for the next month, then we are very likely to see a rapid rise in these cases, whereby we need this kind of economic funding. We've already received quite a bit of generous contribution from various sources, and we have also tried to distribute these contributions according to our needs assessment. Something that I want to bring about over here, a very important and crucial point that we need to mention over here, is that we need very accurate data in order to distribute and to allocate these funds that we have. And this data is coming from our member Jamaats. We have many Jamaats who have filled up their needs assessment data, and we have been able to support them. But we do have certain Jamaats who have not yet filled this needs assessment, especially from Africa, and we really need to go into this. So I just wanted to raise this crucial point, that data is something that we really are banking on to support our Jamaat where the need is greatest.
Thank you, Zuhair. On the economic side, I'm going to go to Mohsen Uncle. If I can ask you from the India side. I mean, when we look at the needs assessment, we see a very big need in India as well. If you could give us some examples of Gujarat and Mumbai and the need there. And then after this question, I'm going to focus on the developed world.
Overall, in India, we have at the moment identified 7,000 families who need provisions very urgently before the month of Ramadan. They also will need to be given a little bit of cash so that they can buy milk and vegetables throughout the month as time goes on. And for that, they will need cash. The number of people who are getting into economic problems is increasing. We have got several hundred rickshaw drivers throughout. Now, all of them have lost their jobs. They can't earn any living. And it's been like that for them for the last 4 weeks. Similarly, the small shopkeepers, they are also now finding it difficult. And the Jamaats have already started supporting these people. And of course, they are respectable people who do not want to be seen as people who are receiving handouts. So it needs to be done privately. And that is how the Jamaats are now organizing themselves to help these people. And of course, there is the Sadats in Mumbai and in Gujarat. We have got a few Sadat families. For example, in Gujarat, we have identified 1,500 families who need support. And for the month of Ramadan, we have already started distributing provisions to them, hoping that we will be able to get funding for that. At the moment, the funding for providing the provision to the Sadats and the non-Sadats, we have had to borrow from the banks. and that is the only way we could finance, because the requirement is too much for the local philanthropists to be able to bear.
Thank you, Mohsen uncle. I'm really hoping with this fundraising that we can do, that we can really help and step up and help you give those funds that are really, really needed and necessary for our community over there. Inshallah, inshallah. I just wanted to say that when we started this show, we were at $300,000. A message has just come in now that a donor, philanthropist, has donated $100,000. That's the Mohsin and Fawzia Jaffer Foundation. I'm very, very delighted that their message has come through. We want to thank them and for their kind donation. They've always been a very supportive family to our community organizations. And inshallah, this donation will go a long way to helping our community members, inshallah. Ahsan to them. I'm going to ask now Arif, actually on the topic of North America, and I'll go to Dr. Akbar as well. There are a number of government bailouts in both, in Canada, in US, and across Europe, particularly in the UK, for example. How effective are these bailouts, according to you? And what do you feel the medium-term economic impact will be on our community? Arif, if I can go to you first.
Okay. So the bailouts are pretty timely. They range from about 2.5 times your payroll for businesses in the US. So which will last about 2 months for payroll, as well as some expenses such as utilities and rent. So in terms of getting the actual stimulus packages, you have to apply. And as of yesterday, we believe the Congress has already run out of that the first part of the funding. So they're working on creating a second package, which will hopefully support more businesses that are on wait list or those who have not applied. So that is turned around within about 2 to 3 weeks in terms of funding once the applications. So that's the general timeline in terms of funding for the businesses. For individuals that are applying, and I'm only talking about the US, Canada, I'm not too aware of what the details are in terms of packages, but the government does take quite aggressive action on stimulus packages for them as well. But in the US, the individuals that have filed for unemployment get an additional package as well, beyond what they get regularly for unemployment. So that does help in a sense that these things have been, for those people that have filed, have seen money come in within 2 weeks. However, there's also some additional funding that the government is going to try to add to that unemployment package that they're already working on. So those are already in place, alhamdulillah. As far as the money is, to come in, that has to be seen still within the next, couple of weeks or to a month or so. However, when we did our needs assessment, we did find that there were families that are in requirement for funding that have low income, and that within our Jamaats can have ranged up to 500 families within North America, which is quite substantive if you think of North America, as a whole. And each family would require between $200 to about $3,000. So there's a variation of what the family requirements are. So based on what the stimulus packages provide the businesses versus what they provide the individuals, we may see that there may be a gap in terms of having to fulfill the need. So it may be, for some it may be a little bit, but more for others. The government has also, and also mortgage companies or financial companies have kind of stepped in to give some leeway in paying mortgages, etc., or even financial obligations. So that is also assisting people to kind of offset their expenses currently. So, which will kind of catch on towards the end, but at least it's an immediate relief, you know, or a medium-term relief.
Thank you, Arif. The same question to Dr. Akbar as well, please.
Thank you, Sean. So I think in UK and Europe, the short-term situation is being managed. So when I say short-term, it's the next 3 months through the various government schemes that are there, you know, such as furlough, where employers are asked to staff off work, and they will get 80% of their wages, and that has been today extended to June. Before it was up to May, and it's been extended further till June. Plus, when staff go on sick, the government is trying to look at giving full pay to the employers, and that is passed on to the employees. Plus, there is the universal credit scheme that those who get unemployed or out of work, and these are various people who are on sort of 0-hour contracts, and they can register for that. And so overall, the economic well-being in the short term is okay, except for anecdotal cases that we are getting who need welfare, and these are handful, not in big numbers. The problem is going to be after this phase, where unemployment will increase, economic activity will be affected, recession, etc., and the impact of that on our community. We are looking at twofold. One is those who are in employment and get unemployed, and those who are in businesses and lose their business. And the impact of that, we cannot judge, but we are laying the foundations and preparing for that. At a regional level, we have got our council meeting on Sunday, and we are putting a paper forward on creating an economic task force of office bearers and specialists and experts, where we want to get the whole of Europe resources together, so that each individual Jamaat is not in isolation, but we combine our human and financial resources together. And I'm hopeful that the leadership of the Jamaat will see that that makes sense, especially the smaller Jamaats whose numbers are small and whose numbers would be limited, that they can benefit from the total pool that we have in Europe. And I think our thinking has to change, where we see the benefit of being together in this, like we are fighting the crisis together and sharing data, good practices, and communicating with each other. And I think that has a major psychological impact on the leadership as well as the community.
Thank you, Dr. Akbar, for that. I think we want to ask some questions, and we're getting some questions in about the post-COVID world. So Abbas, my question to you is, the world probably has changed a great deal. We've had the medical crisis, we've got an ongoing economic crisis. This may appear in waves, for example. So it could be that we go off lockdown in some parts of the world, and we may go back in lockdown again. What do you think? What do you see the world to be after COVID-19? And what do you see? What do you feel are going to be the main changes that all of us will go through?
I heard most of the question, a bit of it dropped out, so if I missed something, my apologies. I think there's something for our communities to really learn from here. Our communities generally have been far behind on implementing technology across the board. To give you an example, just on last week, I had a group of people from Tanzania connecting and asking to be connected. Now, 2 years ago, when we were trying to push this through our communities to get people online and to using new technologies within just our Jamaat, so not even going to businesses, it has been very, very difficult. I think suddenly, you know, our sheikhs, for example, have now become all TV stars and are all having their own channels to produce their own programs. So these little things that we're seeing individually, like right now, having a Zoom meetings, etc., I think will filter through to the businesses. And I think that this will be a real, will have a very large curve upwards in the way technology will be implemented across in businesses in many other ways. In Australia, the government is developing an app which should be ready next week, where we will be all asked to join, and that will tell us if we have been with a close contact with someone who has COVID-19. So we can be sent a signal to go and get tested and various things like that. So I think that there is a lot of doom and gloom when you look at what COVID-19 has been doing, but there is also a lot of things I think very positively in the future, inshallah, that we as a community can develop and businesses will develop as well. Teaching our curriculums and our madrasas, for example, will change also. Today, mothers and fathers, especially our younger mother and fathers, both are working and their children may not be able to go to madrasas. So generally our madrasas have been catering for children who only attend madrasas, but not catering for the majority who are not attending madrasas because they can't get there. Suddenly you can now see the benefit of being able to connect. So hopefully we as a community and you know, take advantage of these technologies to bring us together, but this implementation of technology in our community level will hopefully filter through to businesses. And it's an opportunity, for example, in India, where, you know, everyone is in IT, you know, and this is an opportunity, hopefully, to move our community in different directions, in different businesses and taking this advantage. So inshallah, you know, it is a sad thing that we're going through with the deaths that we're having, and especially in New York, and my, you know, and you know, our condolences to all our communities who are suffering. But there is a bright side, and we shouldn't lose hope that there is a bright side. And we get through this, things will get better, and also our communities will be enhanced in the direction that we're going.
Thank you, Abbas. There are a lot of questions coming in from the audience. I mean, one of them that's come up now is many people who have lost their jobs in Pakistan and India are left with no income during this crackdown, actually lockdown, as there are many dependent on single earners. What will the World Federation do to support such families? So, I mean, just on what the World Federation is doing for the community and what we together are doing as a task force, we have the 1.6 million fundraising plan. Of that, we've already allocated funds to the various regional federations. We haven't collected the 1.6, but we've been bold enough to begin working on allocations. And we do need to fundraise and ensure funds go out to our community members ASAP. The first plan, the first 2 months plan was purely on stuff like rations, on food, on medicine, on that type of thing. But of course, the need will increase as long as the lockdown increases as well. And that funds just helps the local Jamaats, the local regional federations in their work that they're doing. I think for Ramadan relief this year is the most inward Ramadan relief we've ever done. Mohsen Uncle, who knows me well and has been with me ever since I began volunteering at World Federation, and he'll remember the Ramadan Relief Excel that we work on, year out. This year has the highest level of inward investment in terms of where those funds are going. I think we're just under $1.7 million allocated. You know, for example, for Africa Federation, we're jointly working on $150,000 each or $125,000 each committing that funds for our community. On India, the sum is very large as well, approximately $150,000 there, and Pakistan as well. I think Birai Jamaat, we've allocated in Ramadan $100,000 as well. So we're working really hard to get funds to our regional federations where they need it. But you know, let's not make a mistake, that's nothing compared to the needs that are there. They're much bigger needs than what we are doing, and I think we need to continue to do more. And the next question that's come across is one that I want us to move on, is the economy will struggle after COVID, and that is leaving many people under a lot of stress. How can we support them mentally and financially? Now, financially, we've spent about 30 minutes on or 40 minutes on, but one thing we need to take away from this crisis is that a lot of people are in lockdown. They're living alone or in small groups. They're not able to see their parents. They're not able to see their grandparents, and so on. And it does have an effect hugely on our mental health. My question, I want to go to Dr. Akbar. And, you know, when we introduced him, I introduced him as the president of COAGE, but he's also a frontline general practitioner, a doctor in the UK. And I think we should appreciate him for not only doing the community work, but also doing his practice work as well. My question to Dr. Akbar is, what can we do in terms of supporting the mental health of our community? What are your thoughts on that?
Okay, thank you, Shan. So it's understandable that the psychological impact of isolation is there in two ways. One is those who already have existing mental health issues, that they get exacerbated. The other is the impact where the psychological impact of abuse. This is domestic abuse I'm talking about, where it's either of children or of partners, mainly women, is also exacerbated. And there is data, certainly from the UK, in the general community, with the helplines that are available for these abuse cases, has risen by 120%. I see that in my practice, and we need to be aware that in our community, it's like that as well. So as Europe, over the last 4 weeks, as COAGE, we have been meeting together as Jamaat leaders. Right at the very start, we asked the Jamaats to identify the vulnerable in the community, the isolated in the community, who will need help and support. And a number of Jamaats have got volunteers who are connecting with this vulnerable group. In addition, we have got pilot schemes running in Jamaats, where at the COAGE level, we have trained people on mental health first aid. So these are not health practitioners or therapists, but volunteers who can identify people who have serious mental health disease. And their aim is to do signposting, because in Europe, we are blessed that we have got services, and these volunteers can direct these people who may be suffering to the local NHS services that are available. One of the data that's come out in UK is that a lot of people are not, because of the fear, two fears. One is they don't want to engage with the health service because of fear that they may end up in hospital where they'll get infected. And the other is the fear that we don't want to bother the health professionals because we are overloading them and they're already dealing with the COVID crisis. And what I've noticed in my personal practice is that the workload in terms, because we have been dealing with telephone consultations or by video, the numbers have dropped in the last 2 weeks by nearly 30–40% from normal health problems that they would contact us. And the same has been found with accident and emergency departments. So I would urge the community, those who are listening, is that if you've got a medical problem which is not COVID related, the doctors, the health service is there for you, and you should still make contact and get help. Let me give you an example where it may have a serious effect. We have in the UK what's called a 2-week referral, where if a family doctor feels that there is a suspected cancer, they refer to the hospital, and in the hospital they'll be seen within 2 weeks. These services have reported that the number of referrals have dropped by 75%. And because patients are not going to the GPs or to the primary care professionals, they are not then being referred. So the urge to the community is, please, we are there to help you. Don't worry if you are not overloading us. Connect with us, whatever illness you've got, especially with children. Again, there is data that some children are becoming seriously ill because parents are not seeking help. So that's the message that I would like to give to the community, that at the local level, Jamaats are connecting with the vulnerable. We are trying our best to support. There are other services, non-Jamaat services, which are trying to help with the voluntary services that are there. So don't hesitate to seek help and do so either for mental health or for physical health problems.
Thank you, Dr. Akbar, for that. I think also at the World Federation level or the COVID task force level, we're creating a mental health line that should be out very shortly. We have a mental health stream. So every stream of the World Federation COVID task force is made up of regional federations. We're all working together to see if we can help and support on that. I've been reminded by the team to promote the World Federation website because it has the online COVID data numbers, and of course that's as good as the data we put into that. So we're requesting everybody to send in their data to the relevant regional federation as well. Back on mental health, I want to go to Arif Bhai as well. We have a lot of people, for example, in North America, in Canada, etc., who are cooped up at home. What are your tips to them? What are your tips to families who can't see their parents, who can't see their grandparents, so on and so forth?
So the idea is to actually reach out, right? As long as what's happening here, I can tell you on a local level, we've had family majlises or family time via Zoom, and Zoom is a blessing in itself that it gives us 40 minutes of free time. So we need to take advantage of that and really connect with our parents, with our families, and with our friends. Because it is a hard time to stay at home and really, it's a change of lifestyle for everybody, and even in terms of kids, having to do schooling from home is a task in itself. So just to cope in those terms, I think we need to do our part to reach out, and it's actually made us, I think, more connected than we were before. Even like taking a drive down and waving to somebody from outside, just to say hello and, seeing if they're okay, I think would be a great thing to do for at least even, your own personal friends and for volunteers as well. In terms of the mental health that you've touched upon, we have an organization here that in Canada and now in the US called Nasiha. That we were already in talks with prior to this COVID-19, epidemic. But for those that don't know, Nasiha, NASEEHA.org, you can reach out to them for any kind of support that you require in terms of domestic violence, drug abuse, any kind of depression. And they're available in Canada and in the US, so the toll-free hotline. As well as we at Nasimco have created a resource as well for our members and as well as our grassroots in terms of having a website. We have a local website, a North American website, which is covid19.nasimco.org, which is a resourceful website in itself that has a lot of items available from the religious side, from having online programming, etc. But on there is also this Nasiha.org information, and also on the Nasimco level, we have also a hotline that is available for everyone to call. The number is 833-786-1101. For those that need to reach out, don't have any help locally, please reach out to us. We are available from Monday through Friday, 8 a.m. to 4:30 p.m. And thereafter, we will be checking our voicemail, as well as there's a form that's available 24 hours a day for you to fill so that we can take a look at offline. So.
Thank you, Arif. No, I appreciate that. And I think on the WF mental health line, that's going to be introduced very soon. Apparently it's trialing in North America, and I think then it'll be brought out globally as well. On the spiritual dimension, and it leads with the mental health side as well. We don't have our Imam Baras open anymore. We have Ramadan coming now in 7-8 days or so. And really, one of the facets of Ramadan is in the evenings, we go to mosque, we eat together, we pray together, we do our amals together. This is going to be the first time I can ever remember where for probably 30 days, we will not be going to our centers. And that has a huge impact on our communities as well. I'm going to ask Zuhair and Mohsen uncle as well. I mean, how much of an impact do you think it will be? And then if this goes on, for example, into Muharram, it's not unforeseeable this could happen. What kind of impact are we going to suffer altogether?
Yeah, you're very right. Mohsen, but you'll start off maybe, and then I'll continue.
Yes, this is quite a problem, as a lot of people do not have Wi-Fi in their homes, but the majority of the people, over 100%, of the public have got telephones. So anything that can be looked at and people can participate in by the telephone, it is much better and it is required. People do miss it out. We have, for example, locally here, we've already started Quran teaching and Dua teaching in preparation for the month of Ramadan, and that is continuing by phone. And people have now got used to telephoning somebody 300-400 kilometers away. So that is something new that is happening here. And if I may add something that when you talk to Dr. Akbar about the medical side of it, we have now we formed a team of doctors. All our Khoja doctors now are on a team. They are all now taking part and providing a service online. And if they feel that a person then needs to consult a psychiatrist, they then pass on the telephone number of the psychiatrist who then talks to them. So that is a very good medical service that we have provided. And the problem that we are going to face, and we are facing it pretty urgently, is that as you know that a lot of doctors, nurses, and medical staff throughout the world passed away because of the corona. And that is making us worried quite a lot. We have worked out the number of doctors and the number of PPEs or any other protection that is required. And the funding is rather too much for us. We have estimated at the moment $125,000 for this month. And that is much too much. And our doctors are at the moment at risk because they are exposed working with the patients. Another thing that when we will discuss within ourselves is something why the task force is very good that it has been formed. We now need guidance on guiding the people what to do if they have got a virus, if they have got an infection. In the past, we have always guided how not to get it. But now how to protect yourselves and what to do if you have got it, we are working on that. And one controversial suggestion we have received from a German surgeon is that because there is no medication whatsoever, if you are COVID-19 positive, do not go to the hospital. Get yourself treated at home and by yourself, and just don't go to the hospital. Now that the doctors here are finding it very controversial, and we will need to discuss it within our team so that we can start guiding the public what to do, because that time has come. Probably within a month, we now need to start guiding the people what to do if you are now virus positive. Thanks.
Thank you, Mohsen Uncle. Zuhair Bhai, please.
Yes, basically, there are three aspects which I wanted to touch on. The first was, as Mohsen Bhai has correctly mentioned, about the medical aspect. From Africa Federation side, also, we're looking at the PPE kits and we're looking at the medical requirements in Africa, and we find that many a times some of these items are not even available over here, and if they are available, they're of low standards and low qualities. Another very positive point from the World Federation Task Force that we have already been receiving, we're supposed to be receiving the first batch of medical supplies, including PPE kits and etc. from the WF Task Force initiative. And I think this is a very positive step that's really supporting us. There are other requirements in terms of the medical requirements here in Africa, and we will be initiating more and more of these requests as we receive them and the needs assessments for the medical side. The second aspect which I just wanted to touch on was the mental health aspect that Dr. Akbar and also Arif Bhai had mentioned, that the mental health aspect over here in Africa as well, and globally, I would think that this is something that is really affecting our members, that the main aspect when you look at mental health is not knowing what's going to happen. You look at the situation and you don't know what's going to happen, how long is it going to take, will I get this disease, will I not get it? And this unknown is actually the thing that causes many people to get extra stress And the best way that we have found to prevent this is to actually have this kind of organization in place, whereby the people in the members in the Jamaats know that we have people who are supporting us, and they know that they have the communication channels open. So basically in Africa Federation, what we have done is, for example, in larger Jamaats who can actually have a COVID task force of their own, they've already initiated task forces, which I'm sure has happened in many other regions as well. But in smaller Jamaats where a task force might not be very possible, or it would be minimal in terms of the resources which they have, we have already initiated, for example, Dar es Salaam Jamaat is already initiating with all other smaller Jamaats all around Africa mainland to have this kind of a support initiative, whereby we have an outreach program. We show them that we have a structure in place to support them. And the same structure, going back to the same structure, it really helps when we have the WF COVID-19 task force to actually then organize all the different regions also, so that they know that it's not only the members going to the Jamaat level, but it's also the Jamaat level then going to the regional level, and then regional level also going to the WF level, and there's already a structure in place. This structure really helps, and it gives the members some kind of they get a little bit of certainty inside the fact that they will be supported in case this case arises, in case the COVID-19 happens to them. So basically this kind of an approach is being taken for the mental health. And finally, your question, Shanbai, about the spiritual aspect. The spiritual aspect is also something which has really been bothering us, because especially because Mahr Ramadan is supposed to be starting. We have seen various Jamaats have initiatives, like for example, we have the Nairobi Jamaat in the Jashn-e-Qaim program, which was on the 15th of Sha'ban with the birth anniversary of our 12th Holy Imam. We have this program which was held live, and we have reciters who usually would have come to Nairobi and recite. They actually recited over the Zoom platform, and we initiatives which are popping up. Again, this will be actually in the but if this does happen, then in Muharram as well, we will have to really work around this and really make sure that the community members' spirituality, the aspect of spirituality, should be maintained, and in whichever way we can, we will support that.
Thank you, Mohsen. I think one thing I wanted to add was the WF YouTube website. We've got lots of new videos being put on there, so please do visit the website and have a look and utilize some of the great stuff that's being put out there. A lot of questions are coming in. I want to do some quick fire questions so we get some quick fire answers coming through. We've got a question for Dr. Akbar. Dr. Akbar, can you explain what is social distancing and how can we practice this in religious practices such as namaz, burial, and so on?
So social distance is keeping a safe distance between people when you are going around. It's between 2 to 3 meters is recommended because the thing is that the particles that somebody comes out from their mouth or their nose, it's up to 2 meters that somebody can get infected. And because this virus is very infectious, people catch it very easily. That's what social distancing means. Now, that in terms of the burial is concerned, the rules here are that it varies slightly, that not more than 6 to 10 people can attend a burial. And when they attend a burial, it has to be family members or close relatives or friends. Sometimes if a member, if a mayat is been, the person has died due to COVID, then the chances are that the family may be already infected or they may have been exposed, so they need to go into social isolation, which is staying at home and isolating themselves. So they, unfortunately, it's regrettable, it's affecting people quite psychologically, that when someone has died, when they've ended up in hospital or they were in hospital, they couldn't see them physically. And then when they die, they can't go out for the burial, and it's really, really painful. And when I talk to people, you know, it has really had a psychological impact, and the scars of that will last. But it's unfortunate that we are in the situation that we are in. As far as the ghusl kafan is concerned, I'm very pleased that our Jamaats are following the guidelines of using PPE appropriately and protecting themselves. So that aspect is good, and that needs to continue. There is another group, which is those who are at very high risk. And these are people with, of course, older age groups, diabetes, high blood pressure, obesity with a BMI of 40 plus, heart disease, people on chemotherapy, on certain diseases where they're on very strong drugs, that they are being asked to stay isolated at home for 12 weeks. And again, I can talk about the UK because I don't know about the other countries. In UK, GPs should be contacting them to alert them, or they can contact the GP, or the government is writing letters to them. There is some confusion that some people who may not be in that category may receive a letter. On the other hand, those who are in that category may not have received a letter. So that's another thing that the community members need to be aware of. One thing I want to make a comment about our European Jamaats, and I'm sure about the other regions, is that our community leadership took a very bold and great step, that they closed our centers very early on in this crisis. And this may be one reason that this social isolation started early, especially in community centers, that the numbers relatively are small in UK. But we have to understand that you know, this disease is such that we, at some stage, or quite a number of us, some stage, have to get exposed to it. The question is, all these measures are being taken as to when you get exposed, so that when you do get exposed and you feel ill, the health systems can look after you.
Thank you, Dr. Akbar. I have lots of more quick-fire questions for you as well. Dr. Akbar, should we wear masks? The UK government says they're not sure. WHO is suggesting yes. Governments like Austria and I believe the US, some states are also saying that we should wear masks. Should our community members wear masks?
Yeah, thank you very much for that. Again, this is a new disease. So the knowledge about this disease is still emerging and evolving. And the issue of mask is being debated and data is being collected. My looking at the trend that's happening, my suggestion would be is use the masks when you go out. And I've already urged our European leadership to, as a Jamaat, to start getting supplies of masks, because when it becomes much more widespread, the costs will go up and the demand would be high, and the resources would not be available. And I'll suggest this to the other regions as well, to consider the getting masks in bulk so that it can be supplied to the community.
Dr. Akbar, thank you. I have a few more quick-fire questions for you, and then I'll move away from the medical side. I think you're getting plenty of questions, and maybe what we should do is have a program, and I think we are planning it, Ask a Doctor program, when we have doctors from our community on here, and we can ask them questions as well. Dr. Akbar, if someone is exhibiting symptoms of COVID-19, how long should they stay at home in isolation? At times, these symptoms continue even after 10 days. Government guidance from the UK is 7 days, I believe. Other European countries, 14 days. What do you recommend on that?
So what I would say is, if you start getting symptoms, which is cough, maybe running nose, cough is the main thing. Fever is one which is common. In the community, we are noticing that you lose taste, you lose the sense of smell. The critical day is the 6th to the 10th day, where the breathing and the lungs can get affected. And there you have to monitor your breathing and the oxygen level. So we have recommended that people who are at risk of this with chronic diseases to get an oximeter, which is a device that you can put on your finger and you can measure your oxygen levels at home. It's like measuring your temperature with a thermometer in the mouth, ear, or on the forehead, that you measure your oxygen levels. And if that is below 93, then you need to call the emergency services and may need oxygen treatment. Up to 14 days, after 14 days, if you don't have fever and you have cough only, then you are safe to go out, okay, if you want to. But usually those who have the disease and those who get severely affected or moderately affected, they usually lack energy to, not have the energy to do things or go out or do home activities. So especially during the 6th to the 10th day, one of the other ways, if you don't have an oxygen, is if you, by doing very mild activity, like going up the stairs or doing like going to the toilet, you are getting breathless or you can't talk because of breathlessness, then seek medical help urgently.
Thank you, Dr. Akbar. There are some more medical questions, but I'll change the focus and then come back shortly. Question was to myself: is this the biggest crisis you faced as Secretary General? I think yes. We had the Yemen crisis. We know it all well. That was one crisis, but this is bigger. I think it's bigger for a few reasons. Number one, it's global. It's truly global. Every continent is affected. Secondly, because we don't understand the crisis fully yet. We don't understand this disease. We don't know how long it will go on for. We have no idea of the overall impacts. And thirdly, it has an economic effect on every region. Yemen one had an economic effect on Yemen. We could manage it. We could fundraise from Africa, fundraise from Europe. Here we have a global economic issue as well. So yes, this is the biggest crisis. And I guess we'll see how fit for purpose all our institutions are in combating and fighting this and helping our community members. There are lots and lots of questions flooding in. With regard, this is a comment rather than a question, but with regard to mental health, one approach for people who are shy to come forward is to arrange mental health workshops for community members via Zoom by psychologists in our community. I think this is an excellent suggestion, as is the Ask a Doctor suggestion as well, because there's plenty of medical questions coming in. One question back on welfare, and this one I will go to Mohsen Uncle and Shahid Badami. Question is, here, and I don't know where here is, but here are some people who are very humble and shy inside. They might be suffering mentally and financially. However, they don't ask for help as they feel embarrassed. How can we help them? How do they reach out? Mohsen Uncle.
Yeah, this is a criteria not just during the coronavirus. It's a problem throughout our lives. We should be aware of the people around us, and we should be able to detect if any one of them is having a problem. Now, okay, now there's a lockdown at the moment. Normally, if you go to the mosque and if you meet somebody regularly there for namaz, jamaat, and you can easily see if somebody is facing a problem, and that manifests itself. Like what teachers do in school. When a child has got a problem at home, that child's behavior changes, and somebody needs to identify that problem before the person says so. And this we will have to do a little more actively regarding the public. Yes, there are many people who will be suffering and they will not be saying so because they have never asked for any help throughout their lives or for generations, and suddenly they are faced with this enormous problem. We will have to be much more aware the way our Imma used to work and identify people and support them and help them before anybody asks for it. That has now got to be the norm.
Shahid Bhai, please. Thank you, Mohsen Uncle. I think you're on mute, Shahid Bhai. We can't hear you.
Wasif Bhai very clearly said that how can we reach those persons who are white collars, and it is our responsibility, it is our religious responsibility to respect to respect the other person. I would only add one thing, that in economic front in Pakistan, just I want to say that the emergency work was in Pakistan. Emergency work was distributing ration were already much needed, and Alhamdulillah done successfully. But the real challenge is now ahead, which needs more funds as well as much more coordinated efforts. Now in Pakistan, we are expecting many community members who will need our help to pay their house rents or shop rents in the coming months. Sorry, members may need our support to pay their utility bills and their children's school fees in the coming months. We may have to run one or two more cycles of supplying ration and medicines to the needy members. Our members may lose their jobs within Pakistan or even outside Pakistan, particularly in Middle East, and they may come back to the Pakistan again. So we may have to support them for some time till they settle. Members who were running small businesses, their own businesses may suffer due to the economic crisis, and we may have to support them to restart or resettle them their business, and so that they can stand on their feet. So now, for these challenges, we need support of our philanthropists, and we are very much sure, we are very much hopeful that, as always, community elders and philanthropists will support us to encounter these challenges. This, as I got a chance, I thought I should share this with you. Thank you.
Thank you, Shahid. I appreciate that. And a lot of other questions are coming in. I'm trying my best to stay on top of the different questions. I'm going to give this one to Arif Jaxi. How do we maintain a work mindset during the quarantine?
You have to segment your time during the day. So make a timetable for yourself. Try to say, okay, I'm going to be spending this much time for work, this much time for children that are homeschooled. Your own personal time. You need time to have also religious reflection or a Quran time. So all this needs to be really segmented. Make it so that you can maybe even have reminders, because being at home, it's really hard to tell what time of the day it is, even the time of the week, the day of the week. So it's good to have yourself a timeline whereby you can actually have a reminder pop up to say, okay, it's time for chai time, maybe, So take breaks, but I think segment your day so that you can actually have, time for everything during the day.
Thank you, Arif. Appreciate that. And a similar question for Abbas, in terms of health and fitness. People that used to, be able to go to gyms, etc. What can they do now? What are the fitness things that we can do to stay fit and healthy?
It's a really good question at 5 o'clock in the morning, Australian time almost. How to stay fit? Look, having children who do go to the gym, they've found ways to do things at home. I think in Australia, we've been a little bit luckier, is that the lockdown hasn't been as strict, but yes, the gyms are closed, but the government is encouraging people to go walking. People are allowed to go, for example, to the beach if it's for exercise, and they are practicing social distancing. So I think we've been a little bit more fortunate here. But, I was laughing with my kids. In the old days, before we had gyms, we were at home and we were picking up rubbish and putting them in the bins and moving things in our backyard. It doesn't matter what you lift, you can still lift things, and maybe your muscles won't grow as fast as they do at the gym. But as everyone has said, we have to stay positive. We have to continue doing the things that we have around them. And, it's also giving us a moment to remind ourselves what, our past, our past families and that have done 100 years ago when there were no gyms. So, it's definitely something you can do. Something indoors you can do. There are so many games now that you can play, virtual games and exercising, and you can even do boxing where there's someone virtually trying to hit you. So there's a lot of things to do to keep positive.
Thank you, Abbas. Some more questions for Dr. Akbar, all health-based questions, but I think I'll take them because they're quite interesting questions, and the answers also, I'm sure, are quite riveting. Herd immunity, Dr. Akbar, isn't it surely about the fact that everybody will get COVID-19? It's just a matter of time.
Yes. So as it stands currently, just a small caution that it's a new disease, and so you don't know. And the forecast where, it's 50 to 60, 70, 80% may get infected at some stage. And all the strategies that are being adopted is that all don't get infected at the same time. There's also an unknown question is, if you've had it once, will you get it again? There's some data that might be there, but the answer is we don't know. So I think what we as a community have to look at is how do we come out of the lockdown? So when I talk about the community, the government will devise its own strategies, which would be, economic related plus health related. It may vary in different countries. And currently there is variation in lockdown in different countries, depending on the strategy that they have adopted. So, and I've been thinking about it, and I've asked the leadership certainly in Europe to start thinking. So for example, and I'm speculating here, that the children are the least at risk, and, should the schools be open first? So in our case, do we think of opening our madrasas? And then we ask the parents to wear masks to protect themselves or to protect others, that you don't spread if you are infected, which is what the purpose of the mask is, that you reduce the spread rather than getting it as well. Do we have smaller functions at the mosque? For example, when the lockdown, like maybe, not the big functions where you might get a few hundred people, but a smaller number of people. The other thing linked with that is to think those who need to be protected. So these are the elderly or with other, what I call comorbidities, means any other conditions which make you at high risk, because these groups are already being asked to stay indoors for 12 weeks. Although for others, the social isolation is 2 weeks. See, this is the very vulnerable. And I don't mean that, if you've got diabetes, you should isolate for 12 weeks, because these are very vulnerable, where the criteria is much stricter, because we don't want, by isolating for 12 weeks, you do more harm than good in terms of mental health and lack of physical exercise, etc. So it's something to think about that. I think one thing we have to understand is just because, for 2 weeks or 6 weeks, you will have lockdown, you are isolated, and then when you come out, you won't get the disease. That's not the purpose of lockdown, that we will have to get it. And, a number of people I know have, and my patients as well, they're getting it at home. Some are getting very mild symptoms, and some are getting quite moderate symptoms, but they don't need any hospital admission. Very few in our community have needed hospital admissions in the UK, but the numbers, majority, are being managed at home. The good thing is that the fatality rates are lower in the younger people, but it's not to the exclusion if you look at the age that it affects people. And I think the way that you have to see is that the best way is having reduced stress, less anxiety, which then keeps your body's immunity much better to protect yourself better from the virus. And when you get infected, you are able to cope with it and fight the infection. And, I'm not a Maulana, but, having the sort of the moral religious teaching of having patience, having sabr, trusting Allah, relying on Allah, submitting to Allah, that, you're going to get. Doesn't matter where you want to run away, you will get it, and its impact will be there. So let's accept it. And, you know, it's what I would call the phrase, start befriending the virus. That, you know, I'm ready. When you come to me, if Allah wants to give it to me, I'm, you know, I'm waiting for you.
Thank you, Dr. Akbar. That's certainly a very interesting analogy. Of course, please, you know, use sanitizers, wash your hands. Don't encourage the virus to come to you.
Yeah, yeah.
But I think what Dr. Akbar is saying is be ready and prepared if it does. And it's not the end of the world. You know, it is what it is. But let's trust Allah Subhanahu wa Taala, and we will get through this.
And can I say that, you see, people, even a normal flu, when there's a flu epidemic, people get ill. It's just with this one, the slight problem is that some people, for reasons that are still not understood, get severely affected in the lungs, and that has a major impact. So, you know,
thank you. It's like a pneumonia on steroids, as it were. Thank you, Dr. Akbar. Lots of very interesting questions coming up. I really want quick fire answers because then we can get through as many of them as possible. Question to Zuhair Jaffa, and it's quite a tough question. Surely, Zuhair, the numbers of COVID patients would be higher in Africa if there was adequate testing. Surely the data from Africa will only be fake due to lack of testing. Quite a tough question.
Yeah, it is a very tough question, and I think it's a very correct question as well, that, you know, testing right now is very inadequately being done in many of the countries in Africa. In Kenya itself, we have only about 7,000 tests which have taken place out of a population of 40 million. So 7,000 tests is a very inadequate number. And with that 7,000 tests is where now we have found about 260 cases. So definitely I'm almost 100% sure that if the testing was more widely being done, we would have many more cases identified. The thing is that we haven't actually seen a lot of fatalities from COVID, because if a fatality comes in, then it would be much easier for a doctor to then identify. I'm sure Dr. Akbar could confirm this, but it would be easier for a doctor to identify that this was a COVID-19 case which caused the fatality. Now, because of the fact that we have a limited number of fatalities, in Kenya we have about 9 fatalities from COVID-19. We have in Tanzania, total cases are now reaching about 60. In Madagascar and in Reunion, we have a few more cases than that as well. But what I'm trying to say is that, yes, you're definitely right in your question. That if the testing was more widely done, we would find many more cases. And because of the fact that, as I mentioned earlier, our governments over here in Africa aren't as well prepared as the governments in Europe, especially in terms of the support that they're providing to the population. I feel that yes, this is something that we need to look into. We need to try to take precautionary measures and make sure that we ourselves, as our community, definitely we try to have the social distancing that Dr. Akbar has mentioned. We try to ensure that we're taking all the precautions that we can.
Thank you, Zuhair. One follow-up question as well, and the question really centers around the fact that, you know, places like India and Pakistan have local pharmaceutical manufacturing. They have a lot of medical devices on the ground. Same for Europe and North America. They can win the rat race for importing ventilators and masks and so on. Africa may end up at the last in that race. How prepared are we in Africa if that pandemic really explodes?
So if this pandemic explodes, this is what we're trying to really pray against, that this doesn't happen. But if it does explode over here in Africa, then I think these structures that I was mentioning earlier, for example, we have a support line for the students of African Federation who are now studying abroad. We have other structures which were put in place in terms of task forces. We're already in Dar es Salaam, we're already taking certain preventive measures. For example, the Dar es Salaam Jamaat already has ventilators, and it already is looking into the PPE kits that we're supposed to be receiving soon. Again, all of these structures which we're trying to put in place, and we have put quite a few already in place. These structures are supposed to now be the prevention, and they're supposed to be the counter in case of this explosion. And this is one of our greatest fears, because once it explodes in Africa, this COVID-19 will not easily be deterred, especially because of the factors which have been mentioned. Yes.
Thank you, Zuhair. One question that has come in, quite a sad question, is we've been watching very, very sadly and very lonely send-offs to the deceased online. Can anything be done to have more attendees, provided they strictly observe the physical distancing guidelines? I think, I mean, that question, the answer would depend on a region-to-region basis. But in essence, countries have strict measures in terms of how many people can visit a burial. So, for example, in the UK, I believe it's 6 individuals can visit the burial. India, I think the authorities conduct the burial, and so on. So, really, the answer to that question depends on the locality, kind of the laws of that particular country, and what's in that itself. Another one, can the WF assist the worldwide community in keeping updated on various programs in Ramadan? I think that's an excellent one, because there'll be programs all over the place. Some, of course, Avasali will be at 3 a.m. Australian time, but I think we can work with the Secretariat and see what we can do to give people different times, etc. Plenty of medical questions. I mean, I think I'm sitting here on a question that I should be placing on some WHO signboard somewhere, but plenty of medical ones. I'll throw a couple at you, Dr. Akbar. We have only, I think, 11 or 12 minutes left. Question to Dr. Akbar. Why passive immunization, which could be a temporary cure if a vaccine is not available, is not widely discussed or promoted? And then next question, how far away are we from a vaccine?
So can you repeat the first question?
So the first question is why is passive immunization, which the questioner feels could be a temporary cure, not being promoted or widely discussed in the absence of a vaccine? It's basically herd immunity question again.
Herd immunity question. Well, in a way, the herd immunity is being developed as people are still interacting, in the community. And prior to the lockdown, the lockdown was not happening, say, certainly in UK or Europe earlier. They were wanting to time it so that the spread occurred at a controlled rate. So, for example, in London, the rates of those who were infecting others were doubling every 3 days. It's now gone down to 7 days, because of the social isolation. So that, herd immunity, that is happening, all the time. If I take my practice, for example, about 50% of our doctors and staff have probably had COVID symptoms, and either they're managed at home, they've now come back to work, or they had such mild symptoms. So, they are developing, individuals are developing, and it's going on all the time. It's just that what is being focused on is on death rates, where people focus, so that it raises the anxiety. What we don't have the figures is how many millions have already getting the infection and are recovering from it, because testing is not so widely available. So if testing was widely available, so for example, if I tested myself, maybe I've already had it, or, because I had 4 weeks ago, I had a fever for 2 or 3 days, and I recovered and had a little bit of symptoms. But I don't know, because I haven't tested myself. So, and when the test comes, which is the second phase, where the antibody test, where you will be protected, if you already had the infection, whether, you can test that you already had the infection, that would be even better. But again, these are not available at present. Certainly when the vaccine would be minimum a year.
Thank you, Dr. Akbar. I don't have so much time left, but this is an interesting question as well. What are we doing to support our project or our community members, health members, PPE? So for example, what are we doing to support our medics in our community? So the question is a long one about shortage of PPE around the world. And I want to go straight to Mohsen Uncle. If you could tell us, what are we doing to help our community medics who are on the front line?
We have had discussions, and within themselves, the doctors and their staff, they have agreed what kind of procedures to follow in their OPDs and in the hospitals, and how to protect themselves. They've also worked out the minimum requirement of gloves, goggles, and gowns. Unfortunately, the cost is prohibitive for us locally, and we hope we will get some money soon so that we can start giving them physical protection.
Thank you, Mohsen Uncle. I think we have about 3 or 4 minutes left, or sorry, 5 minutes left or so. Another couple of questions coming through. They're all actually all medical questions. I think we've had plenty of medical questions. I think what I will note down to is ask you all just 1 or 2 minutes each. What is your message to the community going forward? What are your reflections on this coronavirus, and what's your message about us going forward into the future? I'm going to start with Shahid Bhai, and then we'll go around, please.
Thank you, Shabbai. What I would say is try to find the opportunities. Try to find the opportunities in this condition. Be positive. Reflect on yourself. Reflect on yourself. This is a very good time for this. And this is a very good time to do ibadat in isolation. There is a different taste in doing ibadat in isolation. So I think this is the great time we should avail this opportunity. That's it.
Thank you, Shahid Bhai. If I can go to Arif Bhai, please.
Okay, thank you. Just want to let everybody know that they are not alone. We're all in this together, as you can see in this team, from World Federation to all the regional bodies to your local Jamaats. We are all in this together. So anybody that needs assistance, obviously your first point of contact will be your local Jamaats. The regional bodies are here to support those local Jamaats, and the World Federation in turn will be here to support all of us. So please reach out at any time. Again, the regional website is covid19.nasimco.org, and you'll get more information there for North American Jamaats. Thank you very much.
Thank you, Arif. Dr. Akbar, please.
So 3 things. I think supporting each other at the local level, at your work level and your family level. So if I can say one thing that helped us in our practice was since the crisis started, every day we were having a half-hour Zoom meeting where we all connected, discussed our own anxieties as to how to manage the situation, how to deal with particular patients, etc. And that has shown that the whole team felt very supported by each other in that. And the learning from that, I've replicated it in others, you know, be it Jamaat leaders, be it with working with the regions at the WF task force level, etc. Secondly, we will have to adjust our lifestyle to the new economic realities that will face us. And it's going to be tough, but what one has to say that sometimes, you know, when you go through tough times, there is light at the end of the tunnel and it'll be better at the end. So that's the second thing that we will have to adjust to. Thirdly is to new ways of living and working. So for example, the use of IT. I mean, I've had to force myself, I'm not an IT techie, to adjust myself to Zoom meetings and, you know, feeling real. Like now, I feel that I'm with all of you in Africa, Pakistan, India, you know, although I can see your faces, and that's good that I have to psychologically say that I'm with you now in a meeting and it may not be face to face. And this can be, is being replicated at a religious level, at a family level. We are having burials and duas and, you know, through Zoom, weddings or engagements through Zoom, birthday parties through Zoom. So I'm sure the new way will be is that when I have a birthday party of my grandchild here, my family members from Canada and Africa and other parts will be joining into that birthday party. And it's good that because we'll be physically distanced, we won't have to, not everybody will have to give presents to the child.
Thank you, Dr. Akbar. Actually, Dr. Akbar, in the various comments that you've made, you have been promoting some companies. You've been promoting pulse oximeters. I'm sure the sales will be going up. You've been promoting masks, and you've been promoting Zoom. And I'm sure the shares of Zoom are going to increase in value after today. Mohsen Uncle, please, and then I'll go to Abbas and then Zuhair. Yes.
I would like to thank Allah for having given the tawfiq to all mu'mineen to wake up to the Islamic way of life, to support each other, to come forward and to be positive. And this has been a great change in the community and a great awakening. And I hope, inshallah, this will continue and we will start a new life in a much more positive way.
Thank you, Mohsen Ankala. Abbas.
You know, it's a huge opportunity for us to connect with our families. For those of us who traveled from Africa to the UK and United States and Australia even, you know, I remember in 1974 sitting at home with my mom and dad and just my sister, four of us having majlis. And, or there was, you know, on the 15th of Shaban, I remember as a child writing arizas, and those are memories I remember till today. There is an opportunity to actually get our children back, not only connected with ourselves, but to actually, we have memories of things that have happened during this period to be closer to God. You know, the moments that your young children will see, for example, I'll give you an example. A couple of years ago, we had a moment where electricity went out for a day here with terrible storms in Sydney. And my father was sitting there and started telling us at the time in Pemba, when he grew up, there was no electricity for like till he was 12 years old. And these are moments to cherish where you can get your family together, read Surah Yasin together, read your Amals together, and really connect with your children and leave a lasting memory like it has for ourselves. So there is a lot of positives out of this. The other thing is serve your community even more right now. Get onto Zoom with your friends, get onto Zoom when your community has Amals and Duas. We had more people at our 15th Shaban Amal on Zoom than we would have had if they attended the center. So there is lots of things. Yes, there's another thing, right? I'm sure all of us listening and all of us participating have contacted family members that we haven't spoken to for months and years, and we've actually seen them live on Zoom. So, you know, take advantage of this. But the most important thing is, just the other day we had our children and all sitting down reading Surah Yasin together. You know, when you go to the mosque, sometimes one person reads it and the children are running around outside and you miss that connection of kids. This is something that you should really take advantage of.
Thank you, Abbas. Thank you for that. Another promotion of Zoom as well. Zuhair Bhai.
I think most of the comments have already been spoken and spoken very well already, but I just want to stress on 2 points over here. The first being that we need to make sure as the community at large, we need to make sure not to give into any kind of yas and despair because of the fact that we should maintain our knowledge that, you know, Allah subhanahu wa ta'ala is there for us. We can always rely on him. We always need to do tawakkul on him. And even if the situation looks like it doesn't have any kind of light at the end of the tunnel for us, we should always rely on Allah subhanahu wa ta'ala, and that light will actually be shown to us. That was the first point that I wanted to stress on. The second point is that from the comments which you mentioned, the questions which you mentioned, especially those which are directed to me directly, I realize that there are people who are really worried about what's going to happen in Africa. And to the members of Africa Federation especially, I just want to mention that with the structures and with the body that we have in place with the WF task force, one of the streams is the medical stream, and the medical stream is actually working very hard in creating avenues. The doctors are collaborating well. I'm in communication with one of the doctors. He was telling me that there are some research papers which are coming out, and inshallah, with these kind of efforts which are going to be put in place, we can always say that there is a lot of support which is coming in from the World Federation, from the regional bodies, from the Jamaat levels. So we should not feel that despair coming towards us. I think that's the main message which I wanted to give us.
Thank you, Zuhair. I'm going to go to Dr. Akbar for one final comment, and then I'm going to try and summarize today. Dr. Akbar, please.
So I just wanted to share something. About a couple of weeks ago, I was sitting on the Musalla, and I thought, let me open the Quran and see what message Allah wants to give me. And guess what ayat came? The ayat to give a loan to Allah, Qard al-Hasana. And I have taken that on board and will apply it to myself. I leave others to think for themselves. Thank you.
Thank you so much, Dr. Akbar. I think really to just summarize really all our thoughts on this is a time to share. It's really a time to share with our families. It's a time to share with our neighbors. It's our time to share with society. This is an example, and it's so lovely to see the the WhatsApps coming through what our community is doing in Orlando, in New York, in Karachi with Huiz Hussain and so on. We're giving to society. For example, I see in Karachi, they're giving PPE out to the wider society, Bilal and so on. This is a time to share. It's a time for us to give to our own community. That's why we need to fundraise, and we want to fundraise today. We need to raise these $1.4 million. It's not even going to do economic upliftment. It's just there to help people get the PPE and have food and have rations and have medicine. We need to raise this $1.4 million in the next week or two at the very latest. And it's a time to just help humanity in general. We can do our part as community members, as Khojas, to really support everybody as much as we can. I want to thank you all for joining us on tonight's show. It was a very long period of time, but I think you found it riveting. I found the questions very, very interesting. I wish I could have gone on and on for at least another half an hour or so. I think we're going to do lots of more shows. Every week I understand that shows are going to be done between now and the end of Ramadan. They're planned about doctors, on spiritual guidance, so on and so forth. Thank you all so much, very much. And hopefully we can have one again soon. Can I end with a Surah Fatiha, please, for all our marhumin, those affected by COVID-19 and all our marhumin. Al-Fatiha.
Thank you very much, Sean, and everybody.
Thank you.
Thank you. Amir, are we off air?
Thank you very much.
Amir? Then I can make some jokes.
No, we're still live on YouTube.
Yes, you can make some jokes. We're offline now.
We're offline. Excellent. Great. Guys, how did you all find it? It's a bit different, isn't it?
Well, it was nice. It was nice. I think a lot of messages got across. I think we managed to get to the core of the issue.